You may have heard of too little estrogen affecting your fertility. However, did you know that too much estrogen in relation to other hormones can really disrupt your fertility too? This is called estrogen dominance, and if you think you might have that, then this is your video to check that out. Hello lovelies, and welcome to another one of my videos in which we'll be talking about estrogen dominance symptoms. As I said, you may have heard that too little estrogen is bad for your fertility, but if you have too much of it in relationship to other hormones, then that is a big problem too. And I'm going to explain that exactly in this video and tell you what estrogen dominance symptoms really are. But before I get into that, I want to stress the fact that it is about balance between hormones. We are not talking about you having too much estrogen. And I did a video on this a long time ago. This is barely edited. This is just me ranting, talking about how it's all about your glands rather than having too much or too little of a hormone. If you want to check that out, definitely click on the card up here and that will take you to the video. There's plenty that you can do to turn estrogen dominance around, so that's the good news. However, there's so much to say about it. I have split this topic up in like 3 topics in the very least that I'm going to start with. Today we're going to talk about estrogen dominance symptoms so you can figure out if you have them and how they affect your fertility. And then I'm going to have 2 other videos coming up. One is about all the things that you can start doing to address estrogen dominance, and one is specifically about how you can raise progesterone, because it is about the balance between estrogen and progesterone. So we've got this video talking about having too much estrogen in relation to the rest, and then that progesterone video is about having too little progesterone in relation to the rest of your hormones. But for now, let's get into this video and talk about the symptoms so we can figure out if you have them. The easiest thing to check first is periods, because your periods are going to tell you so much about your estrogen levels. First of all, if you have relatively high estrogen, you will likely have heavy periods. You may have long periods. So I'm talking 5 days and more. 5 days could still be okay, but if it's like 5 days 1 month, 6, 7, 8 the other months, then yeah, you are on the estrogen dominant side. Another thing is that you might see clotting, and little clots are not necessarily an indication of estrogen dominance, but definitely if you have big ones. I've had patients tell me that they had clots as big as a fist. So if you have that, don't feel like you are the odd one out. You really aren't the only one. It's pretty scary to have that, but this can indeed be an indication of estrogen dominance, and as I said, you can turn it around. Another thing that you will see with periods is not only are they long, but you feel like you've barely stopped your period and then it starts again. So some women may say, I bleed for 2 weeks and I'm off for 2 weeks. I bleed for 2 weeks and I'm off for 2 weeks. This is typical for estrogen dominance. And what you will see is that estrogen goes up in relation to other hormones anyway as we age. So as we get older, we often see that cycles become shorter and shorter. But if that is happening for you, then you know that estrogen is having a party. And then there's another very clear symptom that I see with estrogen dominance, and that is that your periods might be really painful. Again, this could also be due to other things, but if it's in combination with your heavy, clotty periods that come very frequently, then chances are that your pain is indeed related to estrogen dominance. Recently I did a video on endometriosis, and I said that estrogen dominance is a big underlying issue for endometriosis. So you often see that going hand in hand, or sometimes a woman may have painful periods that get worse and worse and worse and worse, and then turns out that she has endometriosis or turns into endometriosis. And I also said in that video that endometriosis seems to come up especially later in life, and again, you see the relationship with estrogen being more dominant as we age. Now let's talk about charting, because you know I'm all about charting, and with your charts you can also pinpoint estrogen dominance. So if you've got all the physical symptoms that I mentioned, then you can head on over to your chart and confirm if that's what's going on. What you will often see with estrogen dominance is that you will have a lot of cervical mucus and good quality cervical mucus. Now this is not the only thing that you will check. If you check all the other boxes that I mentioned, you can still have estrogen dominance. But we often do see high quality and high quantity of cervical mucus because it is under the influence of estrogen that we produce cervical mucus. So that kind of makes sense, right? Another thing is something I already mentioned with the periods, and that is that you will see on your charts that you indeed have long periods. So you may have month after month of 6, 7, 8 days of periods, sometimes even longer. But if they're longer than 4 days every month, then you're definitely leaning towards the estrogen dominance. What you will also see on your charts is that you probably tend to have short follicular phases. I know we talk about luteal phases all the time, so from ovulation until your period. However, from period until ovulation with high levels of estrogen will usually be short. So where we would like it to be, ideally like 14 days, with high levels of estrogen, you will likely see that you ovulate on day 12 or even earlier, day 11, day 10, day 9, and that you know that you need to start taking ovulation tests from day 6, 7, 8, because otherwise you miss your fertile window. Another thing that we often see apart from the short follicular phase is that we see a short luteal phase. And that is because often if progesterone is low, that allows the body to just create havoc and produce too much estrogen. So you will have a short follicular phase, but also a short luteal phase, and it's really there where it started, and then later on you start to ovulate earlier and earlier. Does that make sense? I hope so. Now let's talk about some diagnoses that you might get through your doctor that indicate that you probably were estrogen dominant for a long time before your symptoms got so severe you went to see the doctor and you got this diagnosis. So I already mentioned endometriosis to you and I explained that, so we got that covered. Another thing that we often see is fibroids. If you've been diagnosed with fibroids, then that is often an indication of high levels of estrogen as well. Something else that you may have heard of is endometrial hyperplasia. So this literally means your uterus has too many cells. In other words, the lining is way too thick. And this is often concerning to doctors because this can be a predisposition to uterine cancer. However, again, the roots are usually in high levels of estrogen. And then lastly, we also have ovarian cysts. So this can be a little bit confusing because we also have PCOS. So when do you know if it's PCOS or if it's estrogen related? Well, you're gonna have to look at the history where it's coming from. But it is not unlikely for those two things to go together, or estrogen dominance to start and it leading towards PCOS. Now on this channel, we care about how high levels of estrogen then affect your fertility, right? Well, I explained to you earlier when I talked about the charting that when you have high levels of estrogen, you will often see that you have a short follicular phase, meaning that you ovulate a lot earlier than what is common or what is best for your fertility. The reason that you ovulate earlier with high levels of estrogen is because in the first half of your cycle, you're supposed to produce estrogen and start to thicken the lining again and start your body to mature the eggs in your ovaries and prepare them for ovulation. As estrogen goes up, it starts to hit a threshold, go through the threshold. And that communicates to the body, we're ready for ovulation, so let's make sure that we spike LH, luteinizing hormone, and that's the hormone we pick up on with ovulation tests. So that tells us, okay, LH is spiking, so we're right before ovulation. Now we make use of our fertile window. Remember? If not, make sure to check out my charting course and that will give you a refresher. So back to the high levels of estrogen. If your estrogen levels peak quite early because you have high levels of estrogen, then that means LH will peak early and tell your body to release the egg too early, meaning that there wasn't quite enough time for the eggs to mature properly. And you can imagine if an egg didn't get a chance to mature properly, it will be really difficult for it to fuse with sperm and to develop into a baby. So when I treat women that have high levels of estrogen, that is so important for us to address, just because we can't have that egg drop too fast and then become an issue later on because it cannot be fertilized. Listen, if you ovulate on day 12, it's still possible for you to get pregnant. So don't get hung up too much on that. You can be aware of the fact that you're probably estrogen dominant and you need to do something about it, but don't freak out and think, oh, I ovulate day 12, so I'll never get pregnant. However, if you ovulate on day 10 or earlier, research has shown that it becomes really difficult then, so it's so important for you to address it then for sure. Now going back to the diagnosis that I mentioned, those clearly interfere with fertility. You may already know that. If you have endometriosis and it's in your uterus, that means that your uterus is basically constantly in an inflammatory condition. If it is in such high alert, what do you think it will do with the fertilized egg? Probably not welcome it in the way that it should. Not only that, if you have endometriosis in your uterus, your lining is not going to be soft and luscious and smooth. It's going to be bumpy, so it's hard for an egg to implant then if it's been fertilized. And the same applies to when you have endometrial hyperplasia, because you're not going to have thickening of lining everywhere probably. It's going to be bumpy, it's going to be here and there. So it's tricky for an egg to implant. And then lastly, if you get ovarian cysts because of estrogen dominance, then that can clearly interfere with ovulation itself. This all might sound a little bit scary, but remember what I said at the beginning of the video, that you can completely turn around estrogen dominance. I promise you. There are a couple of home remedies you can take, there are lifestyle changes you can make, and if those things aren't enough, then I really recommend for you to seek out homeopathic treatment. You don't necessarily need to come and see me. There are so many wonderful homeopaths out there that I'm sure that will be able to help you as long as you have the right click with them. And make sure to subscribe to my channel and hit the notification bell as well if you don't want to miss out on my follow-up videos that will be on reducing estrogen dominance yourself and upping your progesterone levels. And if you want to learn more about hormone imbalance and how to treat it, then definitely click on the playlist on your screen right now. And then in the meantime, see you in the next video. Bye!